I'm Stacey Pugh, Lymphoedema Nurse Manager at Compton Care. This is my colleague Angela, Clinical Nurse Specialist, Tammy, Clinical Nurse Specialist, and Jo, Healthcare Assistant, who works with me. We're going to answer some questions. So let's have a look. Is there anything that I can do to help myself at home? So I guess that's a fairly easy one, isn't it?
Yeah. Good skincare. Use your creams on the areas of most concern.
Elevate feet, legs, on like buffets or recliner chairs, and just elevate the legs.
Keep moving as well.
Yeah, moving is key, isn't it? Because I think people think they've just got to sit down, legs raised, whereas movement is really important without putting people at risk, of course.
And I suppose the other thing to say about skincare as well is just making sure that any like little breaks and stuff are treated with like an antiseptic cream and then covered, so either like insect bites or scratches or whatever. And then once people have been to see us, obviously, we'll give them some more specific advice. Does anybody else want to say anything about that question?
I suppose if anybody's got any problems, that they know we're just a phone call away. So just pick up the phone, any worries, just ask. Shall I do the next question? How can the Compton Lymphoedema team help me as a patient?
So we would give lots of advice, wouldn't we? We'd give an assessment first, then we'd base some advice around their individual problem. Some knowledge, sometimes that's helpful, isn't it? Just knowing what's going on. Bit of an explanation on, I guess, just knowing somebody's there as well and somebody can help them with concerns and queries.
I suppose as well for me, it's just knowing that it's not just you come in with a symptom. We don't just look at that symptom, we look at the big picture of how it's affecting you as a person, and we can support people psychologically with that.
We can refer to other places as well, can't we? If we can't help with certain things, we can refer.
We can.
So there's quite a bit we can do for people out there.
Yeah, and there's support groups, isn't there, out there that we can signpost people to, which is key.
Go on, I'll pick the next one. What is lymphedema?
You want me to have that one?
Go on then.
So,
you can explain it.
Quite simply, it's a swelling anywhere on the body, isn't it? So perhaps what people don't always realise is it can affect you anywhere head to toe. But I mean, we generally see lots of legs, don't we? Lots of swollen legs, and people probably notice that more than anything out in the big wide world. So it's a problem with the system that's draining all the fluid, really, in terms of what is the actual problem, but lots of different causes, I suppose. And that's what we usually try and determine, isn't it, when people come in? What's the actual cause of the swelling?
I think people do generally think it's the legs, isn't it? But we do see people with head and neck, arms, breast, all over the body. It's how we can support.
What should I do if I think I have lymphedema? Go to the GP and ask for a referral to see us.
It's not necessarily a GP if they're known to a practice nurse or any nurse out there. Nursing homes, district nursing practice nurses, they can also refer, and it's just dead easy via the website. On every page it says refer to lymphedema.
And I guess people always think it's the doctor, but often the doctors are the ones that don't particularly understand the condition very well. But we have quite a good relationship now with the district nursing teams, don't we? And we've been out to the practice nurses, so they do all know now, don't they, that they can refer straight to us.
So it's any health professional?
Any healthcare professional can refer directly in. And it's easier if it's the healthcare professional who knows the patient, who can give the information that we need.
Why is lymphedema often difficult to diagnose? Oh, that's a good question. Why is it difficult? I think it's about knowledge, isn't it? And that people don't understand the condition, and it will often be misdiagnosed as other things, and people given the wrong treatment by GPs and stuff. often difficult to diagnose.
It's not difficult to diagnose by us though if they come via
Well, I
the
guess that's 'cause
website and the referral. And, yeah.
But we know what we're talking about, don't we? I suppose out there, the GPs and stuff, they've got 100 other things that they could be looking at.
I suppose it's for me being in lymphedema 3 years, it's amazing to me how many healthcare professionals out there still don't understand what it is. And thinking back to a patient I've just seen recently who went with head and neck swelling, and she spoke to her GP because she'd been on the internet, and he said you can't have lymphedema in the head and neck, so she went back. And so it's about us getting out there and educating the healthcare professionals so the patients get the best care and get referred to us in the earliest convenience. Is there a cure for lymphedema?
No, is the short answer. Unfortunately, no, science hasn't got that far for us at the minute, has it?
No, but we can help manage and maintain the condition, because obviously if it's untreated it gets worse, so the best thing to do is to come to us and we can help manage that condition.
And I think once you actually have that conversation with somebody and explain that, it doesn't feel like such a harsh answer, does it now? No. And hopefully science will help us out in the future. I think the recognition and the being able to get some treatment at the minute is often really positive for the person who's coming to see us, isn't it?
And we can, as well as maintain, we can make reductions in some patients. So we can reduce lymph volume to give them a better quality of life. We can make hard tissues soft, reduce the pain somewhat. So there's loads of different things we can do.
It's not a cure, but we can almost, to a patient sometimes it feels like you've reversed it a little bit, because they actually feel better, they feel stronger, don't they, in their limbs. And
it's the quality of life that we're there to improve.
Yeah, definitely.
From a psychological and a physiological perspective.
Yeah. Okay. What are the symptoms?
Okay, so the initial swelling is the main one, isn't it? And we've got people start to complain about other symptoms, which heaviness,
achiness,
firm legs being really hard.
Mobility as well. Sometimes it affects mobility with heavy legs.
Sometimes pain, but not generally. It's generally in the breast area, isn't it? And tissues got really hard.
And I suppose the other thing that perhaps people don't always realise is like that orange peel skin look. That actually sometimes that's an indication of lymphedema, isn't it? That it isn't always picked up.
I suppose the key message with that is the earliest time you can pick up the symptoms, the swelling, the heaviness, seek advice immediately. Don't wait till these symptoms get worse, because as the symptoms get worse, then you become more problematic. There are issues that can occur, so it's really key to get advice soon.
Because even just indentation in where your socks are. When I first started the job, that's what highlighted it to me. I was like, oh wow, so as early as that we can do something about it. So
and we prefer to see people at that stage.
Yeah,
we can do something positive.
Definitely.
Is it your question?
Is it my question? So, next question. What are the differences between primary and secondary lymphedema? So, primary lymphedema is usually, you're born with too many lymphatics or not enough lymphatics, different syndromes that is connected to the primary lymphedema. Your secondary lymphedema is more what's occurred over time. So, if you've had deep vein thrombosis, if you've had cellulitis, surgery, broken bones,
cancer treatments.
There's lots of secondary causes to lymphedema, which we could go on. Ages, with a secondary.
I guess the biggest difference, if you just wanted to put it in a nutshell, is that usually primary is a problem that you've been born with, and a secondary lymphedema is something that's occurred later on, isn't it?
Yes.
Which either way are both similarly treated.
Yeah.
Mm. Do you think that answers that?
I think so.
Shall we go for one of these then? Last but one question. How do you get lymphedema? Well, I guess it kind of leads on from this question, doesn't it? So,
But not everybody who has those factors that we've just talked about gets lymphedema, do they?
No.
So not everybody who's had breast cancer will develop an arm edema. I think there's a lot of work going into genetics, isn't there, to ascertain why some people are more pronounced to it than others.
Yeah, and I guess you've got the risk factors. So rather than saying how do you get it, what increases your chances is things like obesity, sedentary lifestyle, so not moving about very much. If you've got certain conditions like heart problems and stuff, you would potentially end up with swelling, wouldn't you, in your lower limbs. And then other things for like the surgery patients are the things like getting infections after surgery and having to have drainage of pockets of fluid and stuff. Those are all like risk factors, aren't they? So we kind of ask all those things, don't we, on assessment, just to see whether they're ticking those boxes. So I guess it's less about how you get it, but what raises your risk of getting it. And like you said as well, with the syndromes, if somebody's born with a syndrome, there's a higher risk of them ending up with lymphedema.
But you can't just catch it like the common cold.
No. It's not catching. I think we've got one more question.
Shall I do that? Do I need to be under Compton's care already to access support? No, but you need to be referred in, don't you?
We do need a referral in, yeah.
We need a referral so we can do the initial assessment, because before we commence anything we need to ascertain the cause of lymphedema and hear the patient's story, what's led to them being here today, what problems have they got.
I guess that's the other thing that we probably can say though as well, that it doesn't necessarily, because a lot of people think that you have to have a cancer diagnosis, don't they? But we see well patients and the conditions, the sole problem that they have. So I guess that kind of answers that a little bit in terms of just get a referral to us. You don't need to be under the Compton Care umbrella for other things, and it isn't the same sort of kind of thoughts process about it being a cancer diagnosis. I think that message is getting out there more so now, isn't it? Because we probably only see about a fifth of our caseload who've had cancer, the rest are non-cancers.
Yeah, they are.
So, yeah.
And similarly, if they're known to any other service within Compton Care, if they start to get an edema, then speak to the nurse or the specialist that they're seeing who can refer inbound referral to us. We see people quite quickly then.
Thank you for watching. We hope you found it useful, and if you do have any questions, there is a website you can contact us via, and we'll answer what we can for you.